guys. My name is Giuseppe Galifi. I'm a registered physiotherapist, certified sport therapist, as well as a personal trainer. And I'm coming to you from Studio 2 Wellness, your one-stop shop for all your wellness needs. Today what I'd like to do is take some time to talk about golfers and tennis elbow, otherwise known as medial epicondylitis and lateral epicondylitis. Now, contrary to what many of you may think, these conditions are not only caused by golf and tennis. They're caused by many activities, things like typing, things like using your mouse, things like using a screwdriver or a hammer repeatedly. These can also contribute to these conditions. It's usually caused by repetitive movements, things like gripping, lifting, twisting, over and over again can lead to these conditions as well. These are referred to as repetitive strain injuries. So what is the key to treating these kinds of injuries? Well, right away, the first thing you have to talk about is prevention. It could be as simple as wearing a strap, making sure your biomechanics and posture is okay when you're doing activities. Ultimately, our goal is to design a program that's specific to your needs. What should you keep in mind? What should you look for if you think you're suffering from these conditions? Well, first of all, tenderness, either on the inside or outside of the elbow. Tightness through the musculature in the front or outside, so inside or outside of that forearm. In addition to that, pain with those movements we just mentioned, gripping, lifting, and twisting. Commonly, these conditions can be caused by trauma. A lot of my patients come in and say they built a deck over the weekend, or they pulled the brakes off, or changed the tires. That kind of trauma can lead to these conditions very easily. Repeated movements, again, that gripping, lifting, and twisting, as well as poor postures and biomechanics. And I think that's why those little pads and the actual strap are so important in terms of protecting these areas. So, how do we manage these conditions? Well, it's actually really simple. Number one, protection, rest, ice, and exercise. So let's start with protection. The simplest thing you can do is pick up a lateral or medial epicondylitis strap, or tennis or golfer's elbow strap. It simply goes about 2 fingers below the outside of the elbow or the inside of the elbow. And what it does is it takes the force that's on those attachments of the muscle and spreads it along the strap, therefore giving those attachments a little bit of rest and protection. In addition to that, correcting faulty postures and biomechanics. If you're typing constantly, get a pad for that wrist to keep that wrist in neutral. Rest is also key, and that means avoiding repetitive movements, as we mentioned several times already, the gripping, the lifting, and the twisting. Ice, age-old remedy, and it still works. Throw some ice on that elbow, 10 to 15 minutes, 2 to 3 times a day. It will be beneficial. As well, I want to mention exercises. Initially, you'll probably be focusing on some very basic stretches to loosen up those tight muscles. But after that, strengthening will be very important. And the focus of strengthening will be something called eccentric strengthening to really build those tendons up again. If you are suffering from either golfer's elbow or tennis elbow and you're looking for some guidance, feel free to join us here at Studio 2 Wellness. We offer individualized exercise programs, individualized treatment, including massage, acupuncture, dry needling, laser, even shockwave therapy. And before I leave, I'd like to give you the quote of the day. Turn a setback into a comeback. Just a reminder, we do have first aid and CPR training here at the studio. If you are interested, our next course is actually in November. Again, thank you so much for joining me. If you have any questions or concerns, feel free to check our website at studio2wellness.ca or call me directly at 416-994-8608. Thanks so much and take care.